Hi everyone, welcome to week 12. This week we're talking about using qualitative research to extrapolate findings and understand implications for practice. There are two assigned readings. One is related to using qualitative research to develop a manualized occupational therapy intervention, and the other is using qualitative research for developing an assessment tool. So there are numerous uses for qualitative research in the development of assessment tools. We might need to learn more about the domain of interest, so we're going to explore that more deeply. We might want to refine questions and constructs that are included in the assessment, and we might want to get feedback from potential users about the structure and meaning of the questions that we're planning to ask. So the example from your reading for development of an assessment tool is the Pediatric Evaluation of Disability Inventory, or the PEDI. The PEDI is a functional pediatric assessment that is used by different rehabilitation professionals. It evaluates the domains of self-care, mobility, social function, and caregiver assistance needed. It is administered through a structured interview with the child's caregivers and or through observation. And in the original format, it had over 200 questions. So the developers of the PEDI wanted to do a computer adaptive test that would be easier to administer. So in adapting the PEDI for the computer adapted version, it's called the PEDI CAT. So they reviewed existing measures. There was an expert review. They conducted focus groups with parents and clinicians, and they revised some of the items. They conducted cognitive interviews, which cognitive interviewing is focusing about content of questions or the format, or if they make sense to the person who's being given the questions. The items were revised. They did a second round of cognitive interviews on the revised items. So this was a multi-step process to create a computer adaptive test from an existing assessment tool using, again, multiple qualitative approaches. Another example, and this was not part of your assigned reading, but if this is an area of interest, it's something you could certainly look into. There's an assessment tool called the Daily Spiritual Experience Scale. It's intended to measure a person's experience or perception of spirituality in their daily life, and they distinguish between religiosity and spirituality, and they define them as you see here. As religion being specific behavioral, social, doctrinal, denominational practices that are shared with a group, and spiritual practices focused on meaning of life and transcendent interactions with the divine. And in order to develop this tool, the researchers conducted in-depth interviews and focus groups with people from different religious backgrounds. They looked at other scales of spiritual experience. They drafted a set of items. They did another round of semi-structured interviews to get people's take on those items, see if they made sense and how they interpreted them. They refined, and then they did that process once again. So this is just another example of how qualitative methods can be employed to develop an assessment. Now, we also often use qualitative methods to develop interventions. I know when we think about intervention studies, we often think about a clinical trial, for example, a randomized control trial. But before we can get there, it often helps to do qualitative studies to first better understand what the target population actually needs, to better define the problem that's being addressed by the intervention, and also to explore the population of interest if this is an intervention that they want, if it's a problem that they actually need help with, and if the planned approach is going to fit their needs. So one example is the pressure ulcer prevention study. So there is a problem in adults with spinal cord injury who have developed pressure injuries or pressure ulcers, which are basically skin breakdowns, and this is a secondary problem from the spinal cord injury, and they can cause numerous health problems. And in the initial pressure ulcer prevention study, it was a qualitative study really trying to understand how pressures develop. So yes, we know that it happens when people stay still for too long or in the same position for too long, but it was trying to understand how that was happening in the context of their everyday life. And through that study, the research team was able to define a set of lifestyle principles that informed that helped to explain when and how pressure ulcers developed. So things like changing a routine or having a disruption in one's routine would often put people at more risk for a pressure injury. People making a calculated risk of doing something they wanted to do and kind of as a trade-off. Also, our preventive behaviors, people's preventive behaviors sometimes kind of diminished over time. Especially if they were working, sometimes it's hard to keep focus on prevention. And of course, access to needed care or services or supports also was a contributing factor. So the research team took all of those pieces and developed an intervention, a manualized intervention, that was then tested in a randomized controlled trial. And they developed intervention modules based on what they learned from the qualitative study. A very similar approach was applied in the other assigned reading for this week, the development of the Resilient, Empowered, Active Living with Diabetes study. So Piatek et al. Talk about how they developed their treatment manual, how they started with theoretical frameworks, interviews with clinicians, did a qualitative needs assessment with the population of interest, which was young adults with diabetes. They had expert review, they did a feasibility study. So there were a number of steps, and not all of these are qualitative. Feasibility is not necessarily qualitative. But as part of the feasibility study, they did get feedback from the target users of the intervention. And from that, they developed a more refined manual. Again, they did interviews with those study participants. They looked at treatment notes from the study interveners, and they kept a log of revisions from the research team members from that feasibility study as they were conducting the study, they kept a track of suggested changes and improvements. So these are, again, just a few examples of how qualitative research can inform intervention development. So to summarize, qualitative research is valuable at several stages of assessment and intervention development because it helps us define the problem, clarify the content of interest. It gives us an opportunity to get review from experts and get their input. Also, we can include the patient or participant perspective, and also the clinician perspective, which, if we think about it, that's who is also going to be one of our target users. So it's really important to see what they think and get their opinions. Here are your references for this week. I look forward to your rich discussion and questions.